Mr. Davies, you and I have quite a lot in common. Apart from the fact that I was born 2 miles from the Welsh border in the wonderful city of Chester, in your former history, you're MP for Croydon, and I live in Epsom. So we've got quite a bit in common in terms of the geography.
That's right, and I've come home to Wales. Yeah.
Yes, exactly. That's right. Well, I'll be home in Chester, believe me, before I pop my clogs. A beautiful city. Now then, Mr. Davies, the situation looks a bit muddled in Wales. And as you and I are speaking, I think the Welsh Assembly may be even sitting down, having a meeting and deciding on whether or not they want to review the ban on non-essential goods being bought at supermarkets. That in itself is a small issue, but does it indicate that maybe the policy hasn't properly been thought through?
No, I don't think so, Mike. The situation is that in Wales, up to the 28th of September, from end of June, nobody died at all. Then 4 weeks ago, we had 12 people dying a week. Yeah. A couple of weeks ago, it was 42. And then last week, it was 61. So the number of deaths is rising exponentially. And in response to your caller, Kevin from Swansea,
yes,
people are dying every day in Swansea. Now, the thing transmission of this disease is according to how close you are with someone, how long you are with someone, and whether you're in an unventilated space. So if I'm in a queue behind you buying another hat, Mike, then obviously an extra hat isn't an essential item, and I don't want to be risking myself and the other people stuck in Tesco doing that. So that's the idea. Look, we have 2 weeks. And we've had a week's notice to have this policy. It's not like it's been dropped on us the day after, like Boris Johnson, with that no ending in sight.
Yeah.
The people are not supposed to buy non-essential goods in order to reduce congestion in shops and clamp down on the virus. And the basic idea, obviously, is if we lock down the virus people will recover at home or in a hospital or die, and there won't be transmission. And then we'll probably save about 6 or 8 weeks and see us through to Christmas.
Right. Okay. Now, large parts of Wales are, vast areas of beautiful countryside. So why do you put the lockdown on the whole of Wales when shouldn't it have been focused on, your main municipalities, Cardiff, Swansea, those sort of towns in the north, maybe Rhyl and Colwyn Bay? Why has everybody been subject to the same imposition?
Because people do move between areas, and secondly, the area you're talking about, which is Ceredigion, is the only one that runs below the threshold. It's got on the far west of Wales by Aberystwyth. It's got a very low population, and it's a national scheme if we can get it, so we're all in it together. We have a problem with England, of course, that people have been coming across the border. Yes. So originally, when Newport was in lockdown with 50 cases per 100,000, you couldn't go from Newport to Aberystwyth. But with Manchester, with 500 per 100,000, that's 10 times as many. They could have gone to Aberystwyth. So therefore, they're also looking at trying to stop people moving and assembling to stop the transmission of the disease. That's the basic idea.
Yeah, I see. Okay. Now, despite the figures that you've given me, and I'm not challenging them at all, but it was bound to happen that once we came out of the lockdown, the figures would rise up again. But the actual number of people dying in this country from COVID-19 is 0.05% across the country. Is it worth locking down a principality on those minuscule figures? And by the way, the people dying, sadly, are all over 70.
No, they're not all over 70.
Most of them are. Most
are, and a lot of other people are getting it, and they're getting some long COVID, and they can't smell anymore. They have neurological problems. I wouldn't want anyone to have COVID. It could be avoided.
Of course.
But I am just in Swansea. Somebody's dying every day. So. To bring it home, that these people are people's brothers and sisters and sons and daughters and mothers and all the rest of it. And I take your point about perspective. But what I would say is that if you look at places like Norway and Finland, where the death rates have been sort of Norway's 279, Finland 353. Of course, in the UK, it's been 45,000. Well, Norway and Finland are back in action because and New Zealand, because they clamped down on this hard, and then they could open up. If you just have this sort of airy-fairy, or let's see what happens, and we're back at 45,000, that's no good for the economy. It's no good for people's freedoms. It's no good for public health.
Yeah, but in terms of the size of our population compared to those Scandinavian countries, it's not a huge figure. And Sweden, who tried the experiment of, keep everything open, herd immunity, they suffered about the same percentage of losses as we have, but they didn't crash their economy. So what I'm saying, Mr. Davies, is if this lockdown ends in 2 weeks, or it might be extended like it has been in parts of Scotland, then we come out of lockdown. Don't you expect then there will be another uprising in cases of COVID and fatalities? And we just go through a cycle of lockdown, open up, deaths, lockdown, open up, deaths. There's got to be a better way, hasn't there?
Yeah, no, I take your point. But the thing is that we are now in terms of the size of the country, first of all, Wales has got 3 million, which is obviously Britain's more like 65 million. I respect that. But we're a relatively small country in terms of managing this. In terms of going back and forth, well, the idea is that we're quite close now to our NHS critical care capacity. We don't want the NHS to be overwhelmed. And we do think we can, 2 weeks, we can save about 6 or 7 weeks. And it might be that the other things we need to impose much better contact tracing, mask wearing, and personal discipline. A lot of the contact, sadly, isn't between unknown people in shops. A lot of it's actually between households who know each other and they feel familiarity and they feel safe, and they're not. So we need to be more regimented after we come out this lockdown to avoid the repetition you're talking about. And then we're obviously trying to get a vaccine. Yeah.
One of the things that you stood firm on was the extra 20 minutes drinking time for the pubs, and I think you voted against the curfew at 10 p.m. I'm glad you did that, because I think pubs are an essential part of the economy of the whole of the United Kingdom. And I'm not saying that because I want people to go out and get drunk all the time. They're essential. They're essential to the people who work there, essential to the mental health of people who go there. And my research, Mr. Davies, shows that people are very, very safe in pubs, because most pubs are very careful about how they isolate their individual customers, and it's terribly unfair to have closed them down.
Well, can I just say, like you, Mike, I want to keep pubs safe and pubs open.
Yeah.
I didn't vote for that. But what I would say is, this might surprise you, but the situation in Wales is one whereby the pubs have got to close stop serving rather at 10. Yeah. You've got half an hour to drink up, which is sensible.
Yes.
The situation in England was you had to stop and throw everyone out at 10.
Hopeless.
What meant was everyone was in the street and they were messing around, and obviously they weren't safe and they were catching the disease.
Yeah.
And that's what against that. It's about management. And what Brains Breweries, for example, in Cardiff said, well, we only do 3% of our business after 10. So I'm happy for people to be in pubs after 10, but really to stop the serving then, give them time to drink up and move on.
Yeah.
These are choices, I know, Mike.
Yes, okay. Now, in the opener to this show, which you may or may not have picked up, I pointed out that earlier this week, Sir Patrick Vallance, Chief Medical Officer, has said even if we get a vaccine by spring, and that's a big, big if, we're not sure it will effectively stop the spread of the coronavirus, of COVID-19. We can't guarantee that. I mean, it seems to me that we are literally waiting for a miracle, and even if the miracle comes, it ain't going to get rid of COVID-19. So don't we need to approach this from a completely different angle?
Well, I don't think so. I mean, I think he's sort of covering himself. I think he's put his foot in it a couple of times already.
Right.
But a vaccine normally does, it's got a 90% incidence, for instance, wipe out these sort of problems.
Yes.
Well, it won't work, it's true. But around the world, there's a dozen different vaccines being pioneered, and the one by Imperial in Oxford is looking very good, I'm told. But obviously, they're going to do massive tests to check there isn't any long-term damage. So I've got confidence in it.
Okay. Is one of the reasons why Wales have gone for the full lockdown because under your First Minister, Mr. Mark Drakeford, the NHS in Wales is suffering a lot of problems and has come under a lot of criticism for its inefficiency. Are we frightened of the NHS in Wales getting overwhelmed?
Well, we are frightened of the NHS in Wales getting overwhelmed, but the amount spent on the integrated NHS and social care in Wales is more per head than in England. And we've got sort of our PPE sorted out more quickly. And obviously we've got other laws that you're not supposed to travel more than, before this lockdown, you weren't supposed to travel more than 5 miles. So you would never seen like 10,000 people in Bournemouth in response to Cummings. We do things differently, like all the children in Wales will have free school meals over Christmas and they won't in England. I mean, it's not perfect, it's just better.
So what I'm doing is I'm trying to start a campaign to keep the pubs open. I want to keep the pubs open because that's the way we should do it, right? So I'm pretty delighted now to have on the line Mr. Michael Kill, who is the Chief Executive Officer of the Nighttime Industries Association, and he's with me now. Michael, very good afternoon. Welcome to Talk Radio.
Good afternoon. Good afternoon.
Thank you very much indeed for joining me. Sorry you had to hang on a bit while I outlined the point there, but I'm sure you get my drift. Now, in my opinion, Mr. Kill, or Michael, if I can call you Michael, the Nighttime Industries Association is a massively important body in this country, and you must fight until your last breath to try and restore the nighttime activities in this country of pubs, of restaurants, of nightclubs, of places where people can gather and socialise, because it's massively important. What duress are you under at the moment that's stopping you from trying to achieve that aim?
Well, we're under a massive amount of duress. I mean, as you know, the restrictions are changing sort of week in, week out. We're trying to manage guidelines, regulations, and many of these businesses, particularly pubs, which are, pubs, nightclubs, events, the key things that we're globally renowned for are just being squeezed out. The disproportionate measures against the transmission beds that are coming from the PHE are reporting are clearly suggesting that we're just being over-restricted against, and we're very limited with what we can do. We're fighting hard to survive, but as you can appreciate, there's only so much that you can do. We need some help from government in terms of the sustainable sort of financial support. But more than anything, to save jobs, save businesses, we need to get the doors open. That's the thing that's going to be important here.
I totally agree. Now, can I tell you, I think a huge transformation took place in your business over the last sort of 20 years, right? At one time in this country, when you went into a pub and you were served by a naturalised English bar person, the service was quite sloppy. And if you asked for gin and tonic, you got a grubby glass with one piece of ice in it, and nobody seemed quite interested in making it an exciting prospect. Then what happened is, young people from all over Europe came here, from Estonia, from Spain, from Portugal, from France. And all of a sudden, I think your industry was absolutely revolutionised. They brought with them a flair. They brought with them an interest. They brought with them an anxiety to please, which had been missing in this industry for 20 or 25 years. My great fear, and I say this from personal experience, Michael, my great fear is a lot of those young people now who are being squeezed with the work available to them may go back. And one young person who used to serve me regularly at one of my local hostelries has actually gone back to Estonia because she sees no future in your industry in this country. That, I think, is very worrying.
Oh, it's hugely worrying. That goes across the road. You think about artists, you think about bar staff, you think about technicians, production, all of those things. Look, we're in a position, if we're not careful, what we're going to do is literally, squeeze this industry to a point that we're going to lose all the talent, not only across the different continents that come here because they want to learn from a world-class industry.
That's right.
But also, we're not going to benefit from some of that skill set from different countries coming here and teaching some of our youngsters, the craft that they're doing. Particularly artists and some of those people that you don't see at the front line are the ones that we're worried about losing.
No, I totally agree. As you quite rightly say, they brought a continental flavour to this country. Now, are you involved in personal one-to-one negotiations with those people in power who are making the decisions? Have you been able to stress upon them the danger that they're putting your industry in and the reasons why they should relax the rules? Because I keep saying this, but I'll keep on saying it because it's true. You're safer in a pub in this country than you are sitting at home.
Listen, we have been working so hard. Our industry has spent thousands of pounds on sort of getting our venues and our spaces COVID safe. We got to a point we've been able to open with limited capacity from the 4th of July, probably up to about 40% of business capacity just to keep the doors open and keep people employed. We've still got businesses like nightclubs and venues that are closed because they're not viable to open. Absolutely. We're sat with both government departments responsible, both DCMS and BEIS, talking to them openly and stressing the importance of moving at pace to consider the impact of what's going to be happening here if we don't get support and if we don't get a clear roadmap for when we can open or if we can open within that timeline. Think about it now. We've missed things like freshers and the student period. We're about to sort of run through Halloween, which is a huge seasonal
Oh, definitely.
sort of money earner for us. If we miss Christmas, January and February, we're going to lose thousands of jobs and many businesses if we do not get this turned around in some way, shape, or form. But we need to do it safely, and no one wants to compromise anyone. We just need to move at pace. We can't be sort of messing around. We need to move so quickly to get this sorted. And the next coming weeks are going to be important with regard to the negotiations between ourselves and many of the other industries and government.
No, I totally agree. I fear dreadfully for the nightclub industry, Michael. I think until you actually get a vaccine that works, and by the way, at the moment, that's a pie in the sky wish. It really is. They're talking about it taking months up till next spring. And even then, human trials have to start and then placebos have to be used and all that. Even if that comes back, you can't let people into a disco, as I would call it. I spent most of my 20s in discos, Michael. It was, it was disco era, the Bee Gees and all that. And you're literally standing in a room with 1,000 other people. Think of the Beatles, the Cavern and all that kind of stuff. I don't see how that can ever reopen until everybody who goes through the door has got a certificate saying they've taken the vaccine for COVID-19.
Well, we're funny you should mention that. I mean, we are working pretty much every angle you can think of.
Yeah.
As you know, I mean, with things like track and trace, we've got rapid testing coming out. We're trying to formulate a method for sort of ingress and egress so that people can be tested going into a club or a venue, but also sustain some sort of hygiene level within those sources. But it's not just about being tested and going in. It's what happens during the evening, what capacity we're operating at, what goes on during that evening. And the bigger part of this is when they come away, who do they interact with, and what's going to happen from that point on. But we're starting to make some really, really good headway.
Yeah.
And what we need is, and is happening now, is the government are engaging in a point where they're starting to listen to exactly what our environments look like. Because the big thing that's the misconception is it's not a one-size-fits-all. We're all very different. That's what makes the experience so amazing within this country. So we need them to understand the environment so that they can then look at the risk thresholds, and we can then implement the right measures to ensure that environments are safe and possibly get the doors open as quickly as possible.
Well, we'd hope so. I mean, I can see places like Annabelle's, reopening and surviving because it's a luxurious nightclub and there's little couches in corners where people sit. But the idea of a load of young people getting on the dance floor, you know what I mean, and literally swaying into each other's bodies an inch away from each other, that's going to be a different challenge altogether, isn't it?
Yeah, of course. I mean, each one of these venues presents an individual challenge. I mean, when you talk about corridors, staircases, when you talk about smaller rooms or big cabinous rooms, it's talking about things like air change. You're talking about hygiene. You're talking about misters. There's so many different variants now that are out there that we're trying to lock down to give us the safest environment it can, but the most viable, because you also have to understand, I mean, of course, you can make something safe, but will it be viable, and will it be something that people want to return to in terms of the experience? So it's got to be balanced, and we have to understand the full environment to ensure that when we engage so people, so businesses can survive and people will return. Otherwise, it'll almost be like dying a death, putting so many controls in there that people won't enjoy the experience.
Yeah, no, I totally agree. And these politicians will come back to you and say, nightclub industry only represents 1% of the economy. It represents an awful lot more to young people who are making their way in life and need to experience that sort of thing, okay? Thank you very much indeed. That's Michael Kill, CEO, Chief Executive Officer of the Nighttime Industries Association. And the news he has just brought you, folks, is fantastic, okay? This is the big announcement in the show so far. We can tell you here on Talk Radio, on the Mike Parry Show, the disco is not dead.